This conference will now be recorded.
Hello, I wanted to take an opportunity to show you some new coding error messages in PCC related to ADL coding. These will become effective December 7th of 2020. So education is going to be needed for the CNAs and your state certified CNAs prior to the effectiveness of this change. So ADL coding addresses two things: patient performance, in which we identify whether the patient was independent, supervised, required limited assist, extensive assist, total dependence, or that the activity did not occur. Secondly, we document staff assistance. So did we have to provide setup or physical assist? Did we have to set the patient up only? Was there one person who assisted the patient, two or more persons who physically assisted the patient, or the resident wasn't available, refused, and not applicable? So when we're looking at this, we need to know that it's not logical to code a patient as independent or supervision and one or two person assist. However, we've been seeing that happen in PCC. And so for that reason, beginning 12.7, if staff attempt to code assist of one or two for any ADL, whether it be bed mobility, toileting, transfer, ambulation, if they've coded the patient as independent or supervision, they're going to get an error message that prevents them from saving their documentation. They will see this big red error. This one, for the example, is related to toilet use. So it's a lot of words, and I can't expect that the CNAs are going to be reading this error in its entirety and be able to make sense of it, because they don't necessarily know what all these 1, 2, 5s and all of that is. All they need to know is that if this error message comes up, then there's documentation that needs to be fixed before they'll be able to save it. So the message is long, and you can educate them to know that basically all it's telling them is that you didn't assist someone who was independent. So they either need to change the independent code or change the one or two person assist code. They didn't assist someone who was supervised, because supervision is a no-touch sort of performance. They either need to change their supervision code or change the one or two person code. Once the coding error is corrected, staff will be able to save their documentation. Thank you and have a good day.